Imagine you are sitting quietly at home, maybe reading something or watching a show, and suddenly the vision in one eye begins to fade, almost as if someone slowly pulled a curtain down. After a few minutes, everything returns to normal, and because you feel fine again, you brush it off and tell yourself that you must have been tired or strained your eyes. Then only a few days later, you wake up and realize you cannot move one side of your body. Your arm feels useless, your leg will not respond, and words refuse to come out the way they should. This is how many strokes arrive in people's lives. They do not always begin with dramatic pain or obvious danger, but with quiet warnings that appear briefly and then disappear. And because they vanish so quickly, people convince themselves that nothing serious is happening. Inside your neck, on both sides, run two major blood vessels called carotid arteries, and they act like highways carrying oxygen-rich blood straight to your brain, face, and head. Over time, especially as we grow older, plaque made up of cholesterol, fat, and calcium can begin to collect along the inner walls of these arteries, narrowing the space and making it harder for blood to pass through. When this narrowing becomes significant, the brain simply does not receive as much oxygen as it needs, and the body sends out subtle warning signs that something dangerous is happening. These signals are often brief and quiet, which is exactly why they are so easy to ignore. Yet doctors know they may represent the final chance to prevent permanent brain damage. Carotid artery disease is more common than many people realize, and according to health organizations, it is linked to a notable percentage of strokes worldwide. Even more concerning is the research showing that a large portion of people with severe blockage never notice obvious symptoms until a stroke actually occurs. However, many others do receive warnings, not dramatic ones, but small moments where the brain briefly loses blood flow, giving the body a chance to say, "Please pay attention." When we recognize these warnings early, we can often prevent tragedy, and that is why understanding them is so important, especially for people over 50. One of the strongest warnings the body gives is what doctors call a transient ischemic attack, often described as a mini-stroke. During a TIA, a tiny clot briefly interrupts blood flow to the brain, causing sudden changes like vision problems, weakness, trouble speaking, or difficulty understanding words, and then everything returns to normal as if nothing happened. Because symptoms fade, many people think they were tired, dehydrated, or stressed. Yet studies from stroke organizations show that people who experience a TIA have a high risk of having a major stroke within the next weeks, and alarmingly, a large portion of those strokes occur within the first 48 hours. A TIA is not something to wait on or watch because it is not simply a warning. It is the brain practicing what a stroke will look like if nothing changes. Another important signal appears when one side of the body becomes weak or numb. The brain controls opposite sides of the body, which means that a blockage on the left side of the neck may cause weakness or heaviness on the right side of the body. People describe their arm feeling heavy, as if filled with sand, or their leg dragging slightly when walking, while the face may feel strange or tingly. This does not feel like normal tiredness, and it is not the type of weakness that improves after rest. Even if it disappears and you feel fine later, the brain likely did not receive enough oxygen during that moment, and that requires urgent evaluation. Speech problems are another red flag that many seniors overlook. You may be trying to speak and suddenly notice that the words coming out are slurred, slow, or hard to shape, almost as if you had been drinking when you have not touched alcohol. Sometimes the problem happens in reverse. Someone is talking to you, and even though you know they are speaking in your language, the words sound strangely confusing or jumbled. This happens because the language centers of the brain are not receiving proper blood flow. Studies show that a meaningful number of people with carotid blockage experience speech problems days or weeks before a major stroke, And because those episodes pass, they simply ignore them. The truth is, when your brain struggles to organize language, it is telling you clearly that something serious is going on. A particularly frightening but very telling warning is sudden loss of vision in one eye. People often describe it as a shade being pulled downward or sideways, making the vision fade temporarily before returning. Doctors know this happens when a tiny piece of plaque breaks loose and blocks the artery that supplies blood to the eye. If that same piece had traveled slightly further, it could have lodged inside the brain instead. That would not have been temporary. That would have caused a stroke. Temporary vision loss is never something to watch casually. It deserves immediate medical attention. Headaches also play a role, but not ordinary headaches. When the brain struggles for oxygen, it sometimes responds with sudden headaches that feel sharper, stronger, faster, and different from what you are used to. Pain relievers may not help the way they normally do. Some people experience them mainly on one side of the head, especially if blood pressure is elevated or cholesterol is high. Researchers have found that a portion of people with carotid blockage reported unusual headaches weeks or months before suffering a stroke. While not every headache is serious, new, or intensely different, headaches after age 50 should never be dismissed automatically, particularly when other health risks are present. Dizziness and balance problems are another clue. When parts of the brain responsible for balance and coordination receive less blood, the brain cannot accurately sense where the body is in space. Seniors often explain that they feel as if the room is spinning, that they become unsteady and have to hold onto furniture, or that they stumble or even fall without a clear reason. It is easy to assume this is just aging, but doctors warn that unexplained dizziness, especially when combined with other symptoms, can mean narrowing arteries are starving the brain of oxygen. Some people notice a strange whooshing sound in their neck or ear, particularly when lying down in a quiet room. This sound, called a bruit, occurs when blood forces its way through a tight, narrowed artery, creating turbulence rather than smooth flow. Often, doctors discover it during an exam with a stethoscope and explain that it means the artery has become significantly narrowed. A bruit is not harmful by itself, but it is a sign that the artery is struggling, and ignoring it can be dangerous. Memory problems can also occur, and they develop more suddenly than normal age-related forgetfulness. The brain uses a large share of the body's oxygen supply, so even small reductions in flow can affect memory and thinking. People begin to forget simple information, lose track of conversations, feel confused, or find it difficult to focus or make everyday decisions. If these changes appear rapidly or continue to worsen, especially alongside dizziness, weakness, or speech trouble, they should never be dismissed as just getting older. They may be the brain asking urgently for more blood. Another unmistakable warning is facial drooping. The muscles on one side of the face may weaken unexpectedly, causing the smile to look uneven or an eyelid to sag. Stroke awareness groups teach the FAST method: face drooping, arm weakness, speech difficulty, and time to call emergency services, and it truly matters. Even if the droop disappears after a few minutes, the brain likely just lost oxygen, and immediate help can make the difference between recovery and permanent disability. Every minute during a stroke counts, because brain cells die quickly when oxygen disappears. So, what should someone do if they recognize these symptoms in themselves or someone nearby? If symptoms are happening in the moment, such as sudden vision loss, slurred speech, weakness, drooping, or confusion, the safest action is to call emergency services right away instead of waiting or attempting to drive. Many lives and abilities have been saved because someone decided to call quickly. If symptoms have come and gone over the past days or weeks, such as headaches, dizziness, or short memory episodes, It is important to schedule an appointment and clearly explain concerns about possible carotid artery disease. Doctors can perform painless screenings, including ultrasound to visualize blood flow, scans such as CT or MRI to observe blockages, and listening tests to detect bruits in the neck. If blockage is found, there are effective treatments ranging from medicines that reduce clots and cholesterol to lifestyle improvements, and, in more serious cases, procedures that open or clean the artery. Research shows that treating carotid disease before a stroke happens dramatically reduces the risk of one occurring. Fortunately, there are also daily habits that protect these arteries. Keeping blood pressure under control is one of the most powerful things seniors can do because high pressure damages artery walls over time. Reducing LDL cholesterol helps slow or sometimes reverse plaque buildup. Quitting smoking, if possible, repairs blood vessels gradually and lowers stroke risk significantly. Gentle, regular exercise, such as walking for 30 minutes most days, improves circulation and brain health. Eating more foods like leafy vegetables, berries, fish, whole grains, nuts, and olive oil, while limiting processed foods and excess sugar, reduces inflammation that damages arteries. Managing diabetes and attending regular checkups also plays a major role because stable blood sugar keeps vessels healthier. For many seniors, these subjects can feel overwhelming or frightening, yet learning about them actually brings power and peace. Most strokes do not appear out of nowhere. The body often whispers warnings long before danger becomes permanent, and recognizing those whispers gives us choices. If you have noticed even one of the symptoms mentioned, whether in yourself, your spouse, a friend, or a parent, it is not a reason to panic, but it is absolutely a reason to speak with a doctor and ask questions. Taking that simple step can protect memory, movement, independence, and years of precious life. Your body works hard for you every single day, and it communicates constantly in quiet ways. When we slow down, listen carefully, and respond early instead of waiting, we give ourselves the very best chance at staying strong, capable, and independent for as long as possible. You deserve that. Your brain deserves that. And the people who love you deserve it too.